Ready? Good morning everyone. I am Nishan Hajra, Assistant Professor of NS College of Pharmacy. Today I am going to discuss about the topic local anesthetic drug. It is a very important topic in pharmacology subject. It comes under DPharm or BPharm syllabus. So let's start. So before going to discuss about the local anesthetic agent, first of all we have to discuss what is anesthesia. So anesthesia means it is a temporary loss of consciousness or temporary loss of sensation in a particular area of the body or particular part of the body without affecting the consciousness. Anesthesia generally block the neuronal conduction or block the signal transmission in the periphery of the central nervous system. That means if we using the local anesthetic agent, it's block the signal of pain, especially the signal of pain, so that the patient cannot feel the pain in a particular area. So the question is how this anesthesia work or what is the mechanism of action of the anesthesia. So anesthesia generally work by block the voltage gated ion channel, especially the voltage gated sodium channel. It also block the propagation and preparation of action potential. This action potential is generally responsible for producing the signal or transmission of signal in the periphery of the central nervous system. So by blocking the signal, the patient cannot feel the sensation of pain. Now we understand about the anesthesia. Now we discuss what is local anesthetic drug. Local anesthetic drug means the drug which produce the anesthesia, or we can say that the drug which block the neuronal condition at the local particular area. Neuronal condition means it block the neuronal signal which is responsible for any types of sensation in our body. And it also prevent the loss of sensory perception, especially the sensation of pain. That means by using the local anesthetic drug, it blocks the signal of pain to the peripheral nervous system, so that the particular part of the body is become unconscious or become unsensible, so that the patient cannot feel the pain. Okay. Now if we categorize the local anesthetic drug, we can categorize in mainly two types, that is injectable anesthetics and another one is surface anesthetic. So injectable anesthetic means these types of anesthetic is generally used in the form of injection. That means pulmonary drug delivery route, either IV route, intramuscular route, etc. Generally IV route is preferable. Now this injectable anesthetics is subcategorized into three groups, that is low potency and short duration injectable anesthetic drug. Another one is intermediate potency and intermediate duration injectable anesthetic drug, and another one is high potency and long duration injectable anesthetic drug. So first of all we discuss about the low potency and short duration injectable anesthetic drug. Low potency means the drug has a low potential. That means if we want anesthesia or any patient is require anesthesia, in case of these types of drug, we require the higher amount because the potency of the drug is very low and the duration is very short. That means these drugs is act on very lesser time. For example, Procaine and chloroprocaine. Procaine. So Procaine is the first synthetic alternative of cocaine. Cocaine is a topical anesthetic drug. Previously, many people are use cocaine because cocaine is available easily in our environment. It is a plant source of local anesthetic. So as an alternative of cocaine, first of all we use the Procaine, but nowadays Procaine is not used much because of its limitation. So Procaine is generally used as a dental anesthesia. For example, for any types of surgery in our mouth or dental cavity, we use the Procaine but not use much nowadays. And next one is spinal anesthesia. That means any types of treatment or any examination in the spinal cord, we use these types of anesthesia, but this anesthesia is not used, or Procaine is not used for spinal anesthesia because it has some allergic reaction which is harmful to our body. Next one is if we use the Procaine is much amount or higher amount, it may cause the nervous system problem. So it is the major problem. So nowadays Procaine is not used. As an alternative of Procaine, we can use the Procaine. It comes under the same category of low potency and short duration injectable anesthetic drug. Second one is intermediate potency and intermediate duration injectable anesthetic drug. Intermediate potency, that means the potency of the drug is not very high and not very low. It is intermediate, and the duration of action or duration is also intermediate. For example, Lidocaine and Procaine. Lidocaine is also known as a Lignocaine. So Lidocaine used as an alternative of Procaine, and Lidocaine mainly treat the heart rhythmic problem. For example, any patient has a heart rhythmic problem. For that patient, if we use the anesthesia, we can use the Lidocaine for anesthetic action, and pilocarpine or pilocarpine is also used. Another one is high potency and long duration injectable anesthetic drug, that is Tetracaine and Bupivacaine. Bupivacaine, it is one of the important drugs comes in this category, and the maximum dose is 150 mg. So what is the maximum dose? That means above the 150 dose, it shows the toxic effect. So the limitation is 150 mg. To generate the anesthesia, to provide the anesthesia, we can use the Bupivacaine in less than 150 mg in dosage form. And onset of action is intermediate. Now the question is, what is onset of action? Onset of action means how much times the drug required to show its therapeutic action. The onset of action in case of Bupivacaine is intermediate. That means it takes intermediate or not very high or not very low time to show its action, and its duration is action is 120 to 360 minutes. That means the Bupivacaine is provide anesthesia for 2 to 6 hours, and these 3 plus sign denoted that it show the cardiotoxicity effect. So if we use the Bupivacaine is less than 150 mg, it may cause the cardiac arrest or cardiovascular related various condition, etc. Now another one is surface anesthetic. So first of all, we discuss about the injectable anesthetic, that is used in injectable form. So sometimes we require the anesthetic for local action. These types of surface anesthetic either use orally or can use in the form of cream, lotion, ointment, etc. First, we categorize the surface anesthetic in 2 categories, that is soluble and one is insoluble. Soluble surface anesthetic means it is easily soluble in water. For example, cocaine, as we discussed earlier, it is previously cocaine is used as a local anesthetic agent because it is easily available and it is obtained from the plant source. Next one is Lidocaine. Lidocaine is another type of surface anesthetic drug. Its maximum amount is 350 mg. That means above 350 mg, it shows the toxic effect. And the onset of action is very fast. That means if we use the Lidocaine as a local anesthetic agent, it shows the anesthetic action in very less time. Okay, and the duration of action is 60 to 120 minutes. That means after using the Lidocaine, the anesthetic action is remain for 1 to 2 hours. That means duration of action is very low. Now we discuss about the insoluble types of surface anesthetic drug, that is benzocaine. Benzocaine is an important types of surface anesthetic drug. It is available in the market in the form of lozenges to treat the various sore throat, or it is used as a form of ointment. Here we can see it, and in the form of ointment to treat various types of skin related disease like sunburn or to treat various types of insect bite, etc. Or in teething cream, that means in case of infant we can use the benzocaine in the form of cream to treat various gram related disease. But to use in case of infant, it required the doctor permission. But the benzocaine is a major disadvantage which is known as a methoglobinemia. So what is methoglobinemia? Methoglobinemia is a condition where the ability of our body to carry the oxygen is impaired. That means our body cannot properly carry the oxygen. So this condition may arise, but it is a very rare condition. If we use the benzocaine in very high amount, then this condition may arise. So if we summarize the whole of the local anesthetic agent, we can say that the local anesthetic drug, it produces anesthesia in a particular area of the body by blocking the voltage gated sodium channel or to prevent the propagation of action potential, so that the particular part of the body cannot sense the sensation of pain. So these types of local anesthetic are used. And local anesthetic generally used the after surgery because for the prevention of stress which is related to the surgery. And it also used in vaginal rectal examination like cystoscopy and catheterization, etc. So another term is general anesthetic, where whenever we discuss about the local anesthetic, we have to know about the general anesthetic. So two are slightly different. Local anesthetic generally produce the anesthesia in a particular part of the body. For example, if we want a surgery in our hand, so you can use the local anesthetic to prevent the pain in only the specific area, that means hand. But in case of general anesthetic, it produces the unconsciousness in the whole body. That means our body cannot feel the sensation and our body become unconscious. So if we summarize the whole things, that means local anesthetic, that means temporary loss of sensation in the particular area of the body but without affecting the consciousness. But in case of general anesthetic, it prevents the anesthesia or it show the anesthesia in the whole body and the patient become unconscious. So this is all about the local anesthetic drug. Next day I will discuss about the another topic. Thank you.